Good evening. Thanks for tuning us in. I'm Ken Malloy.
And I'm Catherine Hurd. Topping our news, COVID hospitalizations are slowing down in Fresno and Tulare counties over the last week.
CBS 47's Medeiros Babb joins us live at Community Regional Medical Centers. And Medeiros, how are the hospitals doing now?
Well, Ken and Catherine, here in Fresno County and over in Tulare County, officials say that the hospitals are still packed full despite COVID-related hospitalizations going down.
And it is great to see those COVID numbers starting to come down on the state dashboard a little bit. But unfortunately, there's just a lot of other sick people right now in the hospital.
According to state data, since November 2nd, COVID hospitalizations in Tulare County decreased nearly 14%. Since November 3rd, COVID hospitalizations in Fresno County down 11%. Still, Chief Medical Officer Walter Egerton says COVID cases at St. Agnes are severe.
The patients that we are seeing are sick. They are sick. We have a rather significant portion of COVID patients who are requiring intensive care.
Central Valley EMS coordinator Dale Dotson says even though the number of people with COVID in the Central Valley hospitals is going down, the number of non-COVID related hospitalizations is up. So ambulances in both Tulare and Fresno counties will turn people away if the EMTs determine it's not an emergency. It's a policy that was reinstated a couple of weeks ago.
I don't see us changing the policy, at least right now. We continually reevaluate, and we'll reevaluate it again first part of next week and just kind of see where we're at.
On November 3rd, Kauai Health in Visalia called a code triage, which essentially declares an internal disaster due to the high number of patients waiting for a bed. On the 5th, it was called off, but Nursing Department Vice President Carrie Noweski says the hospital is still operating at about 101% capacity.
So resources are stretched very thin. So while I know that people don't see it in their day-to-day like we do, it is a reality for people who want to access health care, that the more patients that we have with COVID in the hospital, in the clinics, in the urgent cares, the harder it will be for people to access health care.
The state has supplied several Valley hospitals with additional staff to help with the surge, extending their contracts until the end of November. Now, officials say that if you were turned away from an ambulance, but your conditions worsen, to recall that ambulance, and an EMT will reassess each individual case. Reporting live from downtown Fresno, Medeiros Babb, CBS 47 Eyewitness News.
Medeiros, thank you much for that. A quick reminder, we do have a coronavirus resources page. It's on our website. Just go to yourcentralvalley.com. It includes resources from federal health officials.